also talk about two major types of planning, that is strategic planning and operational planning. So after that, we had an assignment, so of which I've received most of the assignments in my mail. So we also talk about health planning. That is, health planning is the process of defining community problems, identifying needs and resources, establishing priority goals, and setting out of the administrative action required to reach those goals. We also talk about that the two types of planning, that is strategic planning and operational planning. So we said strategic planning involves creating objectives and setting goals for where the company would like to go in the future, and then constructing a plan of how to achieve those goals. So for instance, hospital setting, hospital environment. We also talk about the importance of strategic planning in healthcare management. After that, we talk about benefits of strategic planning in healthcare management. What are the benefits? We also talk about some key areas that a hospital strategic plan can improve significantly. That is risk management, company culture, service line decision, goals and objectives, capital planning, cost accounting, long range forecasting, operating budgeting. So we also talk about the second type of planning, that is operational planning. So we can be able to distinguish between strategic planning and operational planning. In operational planning, you say is the process of planning strategic goals and objectives to technical goals. And objective to technical goals, they link the strategic plan with activities the organization will deliver and the resources required to deliver them. So from there, we can be able to distinguish between the strategic and operational plan. And we also talk about key components of a operational plan: human capital, risk assessment, financial requirement, estimate of project lifespan, sustainability, and exit strategy. We also talk about two types of operational plan, that is standing plan and the single aspect of it. The single aspect of it is the use plan referred to address a time project or event. So we also talk about benefit of operational planning. What are the benefits? So today we are going to effective management and leadership practice. Effective management and leadership practice. A leader is the bridge between strategic management and their targets. It is because of a leader that organization gets their desired tasks and targets. That is, if a leadership of a particular organization, if there is a fault or something fundamentally is wrong with the leader, with the leadership of a particular organization, such an organization is bound to have problem at the end of the day. So management is responsible for people and resources in a unit according to rules of value that have already been set, while the leadership sets a direction to the people in group. The management is responsible for people and resources in a unit. That is, for instance, if you have uh, accounting units, for instance. An accounting unit will be headed by the director of accounts or HOD accounts, as the case may be. So it is the rules set by the management to be executed by the head of accounts or the director of accounts that he is going to implement. So those rules will be set for the people in that department as a direction for them to follow. And then understanding the link between strategic management and leadership by this example, that good leadership and effective management are always the success in any organization. That is, good leadership and effective management. These are two things entirely. We must have good leadership and we must have effective management. So both of them are always the brain behind the success of any organization. So both of these are the skills which is going side by side. That is leadership, good leadership and management. They go side by side. Without management, a leadership can only satisfy for the time being, not in the long term. Same as an effective management is nothing without a good leadership. That is, both of them they work hand in hand. They complement one another to achieve a greater success for the organization. When great leadership is joined with effective management, a direction will be set and allocation of resources in the best way will be achieved. Management and leadership are important for the delivery of good health services. We are talking about clinical healthcare management. That is the operational management in our hospital settings. How can and good service delivery? So we are now talking of management and leadership. We are saying that management and a good leadership, these are two different things entirely that are necessary, that are required for the success of the organization. So we now said management and leadership are important for the delivery of good health services. Leader will have a vision of what can be achieved and then communicate this to others and evolve strategies for realizing the vision. They motivate people and are able to negotiate for resources and other support to achieve their goals. Effective healthcare leadership, that is, we said we have effective leadership and good management. So we are now particular, we are now emphasizing on leadership. So that's why we have effective healthcare leadership. The healthcare sector is characterized by constant reforms aimed at the efficient delivery of safe, effective, and high quality care. Effective leadership is required to lead and drive changes at all levels of the health system to actualize the goals of the changes as a result of reforms in the healthcare organization. That is, effective leadership is required. Effective leadership must be in place to lead uh, and has become part and parcel of the system because they are not stagnant. So reforms are being held constantly. So in order to make sure that people do not stick to the old style of doing things, because if they stick to the old styles of doing things, so it may be difficult for good healthcare service delivery to take place. So effective leadership is required to drive all the changes at all levels, whether at the junior, senior, middle, or whatever. So effective leadership is required to drive all these level of changes in the healthcare system to actualize the goals of the changes as a result of reform in healthcare organization. The healthcare environment is complex and dynamic. It experiences problems peculiar to its unique characteristics, as well as those besetting organizations in other sectors. That is, what other organizations are facing, the challenges they are that they do encounter in other organizations is not also different from what is obtainable in the healthcare management. The healthcare environment is complex, yes. It is dynamic, yes. It experiences problem peculiar to its unique characteristics as well as those besetting organizations in other sectors. Such problems include internal pressures arising from increased demands for transparency and accountability, increasing influence of various stakeholders such as political and social groups who have vested interest in this sector, and shortage of healthcare professionals due to the effect of aging workforce. That is, this there are some problems that are associated with lack of professionals. When the professionals have reached their mandatory required age of retirement, that is retirement age, so they have to retire, and by so doing, there will be shortage of healthcare professionals as a result of retirement of aged staff. So we also go to factors outside the healthcare environment, such as changing population, demographics, economic factors, government policies, and advancement in medical and information technologies also exert profound influences on the health sector. This, the health sector undergoes constant reform arising from interplay of factors both within and outside its control, or both within and out of its control. However, such reforms are necessary to meet the expectation of the population and ensure the delivery of safe, effective, and high quality health care. That is, after the healthcare sector might have undergo constant reforms, that is as a result of interplay of factors within and outside its control. That is, such reforms are necessary to meet the expectation, the yearnings of the population of, of the people that are expecting the services. Effective leadership has been recognized as crucial in shaping organizational culture and driving the implementation of reforms in health care sector. This is evident in the growing interest in the concept of healthcare management and leadership, and it is reflected in the prevalence of studies on health management and leadership across different countries. Current interest and study in healthcare management, that is, prevailing interest in the healthcare management and leadership are geared towards identification and assessment of essential competencies, that is, knowledge, skills, and attitude. What we are trying to say in essence is that currently in healthcare management, leadership are geared towards identifying and assessing some ingredients in the labor force, in the workforce. That is, they will check for knowledge, how knowledgeable their workers are, their skills. These are two different things: knowledge and skills, and also the attitude. Because you combine the three together, the knowledge, skills, and the attitude. If you have knowledge and skills and no attitude, there is still problem. So these are three ingredients that the leadership, that healthcare management and leadership are geared towards identifying and assessing the competency, that is the essential competence, that is knowledge, skills, and attitude required by health managers and leaders for effective performance in roles. In healthcare sector, the term leadership is closely associated and often used interchangeably with management. In healthcare sector, the term leadership is closely associated and often used interchangeably with management, the word management. Management entails planning, organizing, control, budgeting, implementation, and evaluation. It ensures efficient utilization of resources to achieve organization goals. Leaders and managers each bring their own strength to the table. Leaders are go-getters and are driven by policies. Managers are task-oriented and more hands in their work. Both leaders and managers have a responsibility not to just to themselves. They have an equivalent task. They have a lot of an objective of the organization. So the responsibility that they have is not to themselves, but to the people they serve. It is not just enough to say I am a leader or I am a manager. Through cooperation, good decision, and good trust, leaders and managers can work as to whether the organization has a real fighting chance. That is, it is not enough to say I'm a leader or I'm a manager. It is through the cooperation, good decision, and good trust that leaders and managers can weather the storm and have a real fighting chance to win the task before them. So, as far as clinical healthcare management is concerned, at our level, we are practically constrained to a particular area, that is our area of concentration. In our area of concentration, we are to bring about the concept of value. I'm talking generally now. We are to bring about the concept of value creation in healthcare. In your exams, these are what you should be expecting. Define the concept of value creation in healthcare. And again, to explain how best design the process are to be implemented. And we are also to know how different strategies can be applied to produce value, like all the ones that we explained earlier. And we are also to be able to link strategies to effective management and leadership practice. God willing, uh, I'm almost through with our assignment, and most of us we perform wonderfully. So, by our next lecture, we will be talking more precisely on the strategies to effective management and leadership practice. Though we, as of now, we'll be able to highlight those areas, but since we are still having one more lecture or thereabout, so we'll be able to deeply on the linkages, on the link between strategies to be employed to effective management and leadership practice. How the leadership and the management, the strategies being employed to achieve the desired goal. So we will talk more about that next week. So once again, I want to sincerely appreciate every one of us for being here, for listening to this lecture. I remain my humble self, Afolabi Abiola. So I want to enjoy us and employ us as a student of public health and healthcare management of nursing. We should always lead by example. We should always put into practice all our experiences as regards our studies so far. Let us maintain hygiene rules as prescribed by NCDC, because this pandemic is a war. The COVID pandemic is a war, and it is a war that we health workers and students in public health, healthcare management, that we are together in it, and the war must be won at the end of the day. So let us live in the struggle. Let our society feel our impact as a student, public health, and healthcare management. So thank you. Until we meet next time, remain blessed and take care. Thank you.
the end of the class. Thank you for attending. God bless you.